All right, so hi, Dr. Sai Chung. We're really happy to have the opportunity to speak with you about mental health and kind of have the opportunity to interview you. So, before we start our interview, I was just wondering if you could tell us what you know about our Address Teen Stress project.
To be fair, I don't know very much about it. I know one of the other therapists you interviewed, Jackie, and I noticed that she had boosted her interview with you on her Instagram. And so I kind of went to check it out and I thought it was pretty cool.
Thank you. So, Address Teen Stress is a mental health initiative started by five high school girls. So, there's me, Abba, Vedika, and then three more, Hannah, Alicia, and Audrey. And basically, the whole point of it is to address teen stress, which is something that doesn't really get talked about a lot. So, through series such as Beyond the Brain, which is the series where we talk to future professionals, just like you, therapists, we kind of get to see a little bit more of the background behind mental health and kind of stigmatize like the importance of it. So that's a little bit about our project. So once again, I'm Alba Shrestha, co-founder of Adjusting Stress.
I'm Vedika Panchal, also co-founder of Addressing Stress.
And
That's awesome.
thank you. And we can start the interview now. All right. So my first question to you is if you could just tell us a little bit about yourself and your background.
Sure. I am a 1.5 generation Chinese American clinical psychologist. So I come from an immigrant family. My family immigrated from Hong Kong when I was 3. I spent half of my childhood in Hawaii, and then we moved up to Seattle, Washington, and when I was in middle school. So it was quite a bit of shock moving up to the mainland as I was entering my teen years. In my practice, I specialize in working with Asian Americans on exploring their cultural identity, their early childhood relationships, and how that relates to their relationships with themselves and with other people. And a lot of this work came out of my own exploration of who I was growing up kind of in different places, in the different cultures, and trying to figure out who I am and where I fit in.
That's really amazing. So, do you think that your cultural identity can affect your mental health? And if so, then how?
Yeah. So absolutely. So cultural identity is kind of a part of who you are, where you kind of integrate these different cultures and subgroups from who you from which you belong to. And generally, people think of like ethnic culture. So for a lot of folks, it's like growing up Asian in America. So they think of like the Asian part of their ethnicity, whether they're Chinese, Japanese, Sri Lankan, Indian, Pakistani, right? And then growing up in America and in the region they grew up in, and how those two integrate together. And that can be really tricky, especially if you grow up in an area where there aren't a lot of people who look like you, or aren't a lot of people who can reinforce those norms that you might have in the family, the house that you grow up in. So when you're struggling with those discrepancies, the differences between what you're experiencing outside of the home and inside the home, it makes it hard to figure out who you are and what you stand for. You might be one way at home, another way at school, and not know like what's really you. And when folks really struggle to know where they fit or where all these different pieces of them fit in their one person, it can cause people to feel confused, misunderstood, this lack of belonging and not being understood by their parents, which can cause things like feeling stressed, feeling anxious, or feeling depressed.
So, although you don't primarily work with teenagers, do you think that bad habits start from the teenage years and can it be carried on to adulthood, resulting in stress and attaining a negative mental health mindset?
Yeah, I wouldn't say bad habits necessarily. I think like what I tell my patients is like we do the best we can with what we have when we have it. So when we first start doing things that might end up as bad habits, we don't think of them as bad habits, right? We think this is the only way we have to cope, like um, hiding under your bed when something scary happens, or crying really loudly as a baby when you don't get the thing you want, right? It works fine as a baby because babies don't talk, like they can only cry. When you are 7, 8, 9, it becomes way less cute. When you're 15, 16, 17, people might actively reject you for crying when you don't get your way, right? And so I like to think of like coping skills kind of having a shelf life. Some of the coping skills we have work for a certain period of our lives, and then they become less effective over time, or they stop being effective. Less effective might mean they don't work as well as they used to, but still might work. I mean, if a 15-year-old's crying, she might get that attention she needs, but it's not going to fix everything. And so sometimes things become used less because you learn different coping skills or better coping skills that fit the developmental level of your life. If you keep using those same coping skills and they stop being effective, that's when they start becoming more actively damaging. Like folks who maybe start drinking to cope with their hard feelings, right? When you first start drinking, you don't think, oh, I'm going to get in trouble for this one day, right? It's just, I'm having a bad day. I'm going to have a beer. I'm going to have a glass of wine. I'm going to have an edible. It becomes problematic when you get stressed, like at work, and you start drinking at work, or you go to work or school high because you can't deal with whatever is happening, right? So the actual skill may be more objective or neutral in whatever it actually is. But if we do not fill your coping toolbox with more things that you can actually swap out as needed, it can become a bad habit. It can become things that are more damaging long-term down the line if it's the only things we have and they are no longer helpful. Does that make sense?
Yes, thank you. That was really amazing. So what have you learned from the journey of becoming a psychologist?
I've learned a lot. Was there something specific you wanted to talk about in regard to the journey of being a psychologist?
So when you sent us your resume, it was like 8 pages long, and I was like, holy cow, like there's a lot of things like I was like wondering about. So I know you do a lot of research, you've done just so much, and I just wanted to like you to kind of talk about your experiences through all of that and how you got to where you are today. If
Okay. No, thank you. No, that's great. For in academia, like if you go to grad school, if you're in that professional space, your resume is that long and longer because you just put everything you've done on it. When you work at like in a business or you work in tech or something, you have like a 1 or 2 pager, right? Very, very brief. When you go to grad school, you have these very, very long things where everything is put on it. So I'm humbled that you're impressed by it. It's probably way less impressive than it actually looks. A lot of that stuff I did in grad school. So the research I did in grad school, a lot of the different places I worked at were my training sites. I was a teaching assistant in grad school. I helped, I did guest lecturing, I graded homework, I tutored, I mentored, all these different things. So you get a lot of different experiences in grad school and in regards to a lot of things in my CV. We're also encouraged to do presentations because you put it on your CV and it looks really good. And it also allows you to understand and talk about the research that's happening in these areas that you're interested in. So I've done a lot of different things. I've worked in community mental health. I've worked at universities, at VAs. I've served a lot of different things. Ended up in private practice. So I'm my own boss now. I work primarily with Asian Americans, adults, in working with all these different things. A lot of times folks come in with relationship, things with their families, things with their kids, things with, where do I go from here? Like, what do I do with my life? These big questions that we start thinking about in high school. Am I happy with what I have? Am I who I want to be? And we explore those. I also work with couples. So as I don't know if you guys know yet, but all the stuff from your family comes up in your romantic relationships. And so we talk about how that happens, how we're triggered by things that we don't always understand, or we don't even know we're triggered by, what we're projecting onto a partner, and like what we're hearing from our partners, how we can ask for support instead of just expecting them to do what we need to do. Things like that. Also do testing. So I do like ADHD, learning disability testing for like teenagers and older. So some folks just need a diagnosis. Some folks are looking for accommodations for school or for work. So it's
and
been a lot of different things. I like having a lot of different things so that I'm never bored.
and how did you know that this is something that you wanted to pursue as a career? Like what kind of interested you into this field?
I stumbled into this field by accident. I did take AP Psych in high school and I really liked it. But back then I thought I was going to end up in music or in creative writing. I was actually a creative writing major when I was at the University of Washington. And I was like, oh, I should just take some psych classes because that's going to help me like understand the human psyche more, and it's going to inform my writing and it's going to be great. And then I really started falling in love with psychology, the idea of being able to understand people and how they got to be where they're at, and then like be able to help them with the things that they come in with, the things that are hurting them. So I ended up switching to psych completely, and then realized in my senior year that there's not a lot you can do with a psych bachelor's degree. And then so being the overachieving Asian immigrant that I am, I was like, oh, let's go to grad school. Let's get that doctorate because I don't want to deal with blood. So I can't go to med school. So I ended up in grad school, really enjoyed doing the therapy piece, the assessment piece and learning. And then coming out of grad school, was trying to find a job. The job market was not great. So started my own practice. And 8 years later, here I am, still kicking it.
That's awesome. That's really cool to hear. So when it comes to therapy, how do you think therapy can help an individual with mental health issues?
Therapy can be super helpful. So it kind of depends on what they're coming in with. Sometimes it is skills, like so learning how to manage their stress, reduce drinking, get them to exercise more, get them more sleep. It's amazing how things can clear up if we can just get our bodies in balance with what we need to do, get healthy, get strong. Sometimes we're having problems with their relationships. So then we do a lot of process work. We do thought experiments, like what would it be like to talk to this person about these things? We might set them up and have them practice having these hard conversations with people they care about. In couples therapy, we definitely want to make those relationships safer so that the people in them can be open and more vulnerable and get their needs met. In individual therapy, we can still do that on an individual basis where we're talking through what's hard for them in their relationships, what gets them stuck in their relationships, and ways they can have big conversations or even identify whether these relationships are helpful to them or more not helpful to them. For some folks, when they've had a lifetime of just really hard things happen, being in therapy gives them a place to process it, their stress, heal, understand those experiences a bit more so that they're not passing it on to their kids or to having it impact their friendships and relationships.
So as you are an adult, and we're just teenagers, like kind of for our knowledge, how do you think your coping mechanisms has changed since you were a teenage girl to now?
I think, frankly, I'm not sure they changed that much. I'm someone who's really self-reliant, so I usually try to take care of it myself. I think I've learned, and I'm still learning, that it's important to reach out to people around me, to have a good social network, not just because it's nice to have friends, but because those people want to be there for you. They want to help you, just like you help them, that we can receive help as much as we can give help. Having a therapist is great. So many therapists have their own therapist. I'm one of them, to give us a place to talk through the things that trigger us, that are hard for us, because in the work that I do, it is important to stay as much on top of our stuff as we can, because we don't want it affecting the work that we do with our patients, with our groups, with our couples, with our families. And identifying, I think as you get older, you can learn to be more self-aware of your patterns. We become a little better at identifying what we want, mostly because people stop telling us what we should want. Once you're an adult, you don't have that, the next grade, the next class, the next school. It's all of a sudden it's, oh, you have to choose your own adventure, which is a whole thing in and of itself. But it does give you the agency to seek out the resources you need, whether it's therapy or help from your friends, from your family, medication. There are more options to you if you're an adult.
Thank you. That's really cool. That was really inspiring. Like as me, I struggle with coping my mental health too, and that really helped me. So, lastly, what advice would you give to someone that's struggling with their mental health, or just like a message to our Address Teen Stress audience?
Yeah, I think if you are a teenager and you're struggling with your mental health, I think the first thing I'd like to say is that you're not alone. I think being a teenager these days is incredibly difficult. You folks are dealing with different stressors, different kinds of pressures that my generation have. Like, I didn't get Facebook till college, right? I'm about the same age as Zuckerberg. So I didn't have to deal with like TikTok or Snapchat or any of that in school. I can't imagine how hard it is to deal with that kind of pressure, right? To have everything at my fingertips, right? Gossip flies so fast. It's not just a note in the locker. Now people can put it on a website, on their blog, on their social media. Like, it is, dealing with the social media stuff can be so challenging. And I know that has a lot of negative effect on teens these days. So you're not alone. It is really, really hard. I want to impress upon you guys that there's help that you guys can get. If you need support, there's your school counselors, there's your friends. You can, if you feel safe enough, ask your parents to see a therapist. Sometimes if they're not so sure about that, you can ask to go see your pediatrician. And doctors these days are better at screening for anxiety and depression and then referring to therapists. So even if your parents might not be so sure about you asking for therapy, they might feel differently if your doctor is recommending therapy. And that finding a good therapist is kind of like dating, right? Not everyone's going to click with you, and that's okay, but don't give up after the first one if you can handle just the search. The earlier you get on that, as much as you can, I think the better, mostly because you're learning more about yourself. You're learning how to cope better. You're learning how to heal and manage your emotional stuff and your trauma stuff at an earlier age, so that there's less that you're bringing with you as you get older and going into college or your relationships or those other future plans that you have.
All right. Thank you so much, Dr. Chung. We really appreciate it. And me and Vedek are both Asian American, so I think I can speak for her too. We think it's really cool that you kind of specialize kind of towards Asian Americans, because we know it can be very difficult, especially for Asian Americans to actually reach out and get therapy. It's not very common in our community. So I think what you're doing is really amazing and really inspiring. And hopefully it's also kind of teaching our Address Teen Stress audience about more things revolving mental health and like how culture plays a really big part when talking about mental health as well. So,
Absolutely. Thank you for inviting me.
Vedika, do you have any last words to say?
No, just wanted to say thank you again. Like, just as Abba said, as us, like as Asian Americans ourselves, we find you really inspiring. And this was just a really in the sense like comforting conversation to see how also like we can also evolve, and even though we have our separate struggles, but we're all the same. We have resources for us, and I just want to thank you so much for helping specifically Asian Americans reach out and be comfortable. So thank you.
I'm glad. Good
So,
luck, ladies. You guys got this.
a request I have for you is if you could send us some pictures for when we make your post on our like Instagram, some pictures of just you or like you in action, whatever that might be. And then I was also going to ask if you could kind of tell us like a fun fact about you. You can tell us this later, but it's just something silly to like be a little more lighthearted. So we've gotten some things in the past is like somebody can do an Animal Crossing impression. Somebody puts like 3 hot sauces on everything they eat. Just something silly or unique about you. So yeah.
Okay. I'll have to think about that and get back to you.
And can I take a
Okay.
picture real quick for our Instagram? Is that okay with you?
Of course, yeah.
Awesome. Okay, thank you so much. Do you have any questions before we end the interview?
Nope. I'll look up some pictures, then I'll email them to you.